My name is Dr. Sean Teague, and I am a radiologist at Indiana University Health in Indianapolis, Indiana. I want to discuss with you for a few minutes today about your safety during a magnetic resonance imaging or MRI exam. The MR machine does not use ionizing radiation. Instead, it uses a large magnet and radio waves combined with a computer to create detailed images of your body. You may be placed head first or feet first inside the tunnel of the machine. You will need to lie still for between 30 and 60 minutes. The MR machine should result in no pain during the exam. There are loud clapping and clicking noises. Therefore, you will be given earplugs and/or headphones to listen to music during the examination. Because of the tunnel configuration of the machine, some patients may find they have claustrophobia. If this is the case, there are select scanners with larger openings or tunnels which may be used. These are called open or large bore scanners. MRI is very useful in evaluating diseases of various body parts as listed below. MRI is very good at identifying abnormal areas of soft tissue, such as in tumors, as well as evaluation of the blood vessels throughout the body. MR units contain a large magnet which attracts certain types of metal. Many pacemakers, neurostimulators, and aneurysm clips are not MRI safe. They can malfunction or move inside your body. Of note, many aneurysm clips in the brain, however, are MRI compatible. There are, however, many implants and devices such as joint replacements, stents, and heart valves which are safe for MRI exams. Even with metal implants or devices that are MRI safe, if the area of the body to be imaged includes the metal object, there can be degradation of the overall image quality. Contrast may be administered to help improve overall image quality. Allergic reactions to contrast are rare. Nephrogenic systemic fibrosis, or NSF, is a rare complication of using large amounts of contrast in combination with poor kidney function. You may be asked to have a blood test prior to the study to evaluate your kidney function. Shown here are knee MRI images where we can clearly see the bone. Here is an MRI exam in a different patient with a knee replacement. Notice the large black area in the middle of the images, which is artifact from the metal of the knee replacement. Anyone entering the scanner room will be asked to fill out a screening questionnaire. The purpose is to ensure no metal objects that could result in injury to you enter the scanner room. Wear comfortable, loose-fitting clothing that does not contain any metal snaps, zippers, or fasteners. Please be sure to leave any metal objects such as jewelry, glasses, keys, belts, etc. in the changing room locker, as they can become projectiles in the scanner room. You will be given earplugs and/or headphones due to the loud clapping and clicking noise the scanner makes during the exam. If your exam requires contrast, a small needle will be placed in the vein of your arm for administration. Claustrophobia is the fear of being in a closed or narrow space. If you have claustrophobia, you may need medication given by mouth or through a vein in your arm to calm you during the exam. Open or large bore MRI units may be used instead of sedation. Sometimes having a relative or friend in the scanner room can have a calming effect. This is especially true in children. A device that allows you to see out of the tunnel using two-way mirrors may also be used. There is no known risk of MRI in a pregnant patient. However, the use of MRI is limited during pregnancy and is reserved for the evaluation of specific important disease entities. If you need to receive contrast for your exam and are breastfeeding, the amount of contrast that is passed to your baby through your breast milk is minimal. There is no evidence to suggest you need to stop breastfeeding. If you are concerned, you may pump and discard your breast milk for 24 hours, at which point you may resume breastfeeding without concern for passing contrast to your child. A radiologist is the medical doctor responsible for the imaging exam. If you have any questions or concerns at the time of your exam, please ask to speak to a radiologist. Thank you for your attention. I hope this discussion helped you better understand the safety of your MRI exam.